Effectiveness of drug treatment programs. Table of contents, starting with why effectiveness matters. Safety. Drug courts are a way to keep people who commit nonviolent, drug-related crimes out of prison. Instead of jail, they go into programs that may require mandatory drug treatment, regular drug tests, and consistent monitoring. California currently has more than 400 collaborative courts in all but 2 small jurisdictions, with many jurisdictions having 4 or more types of collaborative courts. However, there are many considerations to take in when considering this route. Mental health and recovery. There are current organizations that help and measure the outcomes of the drug treatment programs and drug courts. National Association of Medication and Treatment Providers and its Foundation for Recovery Science and Education. With the information from these programs, specialists are able to ask questions and clinically assess which treatments will be best for each individual. Drug courts need to take into consideration the damage drug use has had on the individuals because it could lead to more trauma if not addressed correctly. Incarceration can trigger individuals to act more erratically, leading to more trauma or more medical problems. By learning to cope with stress and triggers, patients are better able to prevent a relapse, which protects their overall health. Physical health. Addiction is a disease, and recovery is possible for everyone. Addiction is not only a mental battle, but a physical one as well. Your body may begin to have withdrawal symptoms and cravings. Some addictions may require medication to get over. Research has demonstrated that MOUD has helped users overcome the physical symptoms they feel. The Portugal study. This study focused on treating the substance use, mental health, and the social life all together. This study contained 290 adults, 215 of them drug users, and 75 alcohol abusers. It was mostly men ages 18 to 75. The key factors. Key 1, they had fewer mental health problems and improved recovery. Key 2, patients who actively participated in their treatment had better recovery results. And Key 3, alcohol programs had higher abstinence rates. The findings. This was most effective when treating both substance use and mental health. Social support was also important. Active participation improved success, and patients with fewer psychological symptoms did better. The conclusion, programs work best when they treat the whole person. This includes mental health, social life, and substance use together. Number 3, drug courts. Drug courts focus on recovery and rehabilitation over punishment. Outcomes linked to strength of treatment programs. Drug courts were most successful when participants had access to strong, well-run treatment. If the program was weak, court outcomes were also weak. Weaknesses included in delivery and cultural awareness. Some programs struggled with consistency in how treatment was delivered. Many also lacked cultural awareness, meaning they didn't fully address the needs of diverse participants. Evidence-based and CBT programs. Programs using proven methods, especially cognitive behavioral therapy, led to the best long-term results. These programs gave participants skills to change thinking patterns and reduce relapse. Conclusion: drug courts only work if treatment programs are high quality, evidence-based, and culturally aware. 4. Recovery support. Long-term change. The focus is on rehabilitation rather than just punishment, which helps break the cycle of addiction and crime. The longer the program, the higher chances are of success. Those who actively participated in a treatment program for 90 days or longer were 22 to 43% more likely to have gained employment in the year following treatment than those who went through a shorter treatment program. Recidivism. Graduates of these programs usually have lower rearrest rates compared to those who go through the traditional system. The possibility of being tested for drugs or alcohol can be enough to stop some people from relapsing. Programs offer different types of resources for life after drug treatment. These things include individual therapy, which is personalized to focus on the individual's unique needs and experiences, checkups, which can look like medical exams to monitor physical and mental health, 12-step programs, such as AA, which is Alcoholics Anonymous, or DNA, which is Narcotics Anonymous, and alternative support groups. Pregnant women in treatment. Compared ASU and GAIN tools. Researchers tested two assessment tools, the Addiction Severity Index and the Global Appraisal of Individual Needs. Both were designed to track how women responded to treatment. Effectiveness? Both tools were reliable, but GAIN offered a broader picture. It captured areas like HIV risk, mental health, and social factors that ASI did not fully measure. This showed reduced drug use and a better recovery. Women in treatment had lower substance use and fewer withdrawal symptoms. They also reported better employment outcomes and healthier recovery environments. GAIN may be the stronger tool for this population because it tracks more issues that affect pregnant and postpartum women. 5. Costs. A comprehensive drug court system typically costs between $2,500 and $4,000 annually for each offender, compared to the $20,000 to $50,000 per person per year to incarcerate a drug-using offender. The average annual cost for the California Department of Corrections and Rehabilitation to incarcerate a person was $127,800 per person at the time of the 2025-26 budget was enacted. Costs can vary depending on length of program, type of treatment, and whether inpatient treatment or outpatient program. This chart shows the cost of each treatment per episode. This is a 2016 study. So in the first column, you see the type of treatment. In the second column, you see the average episode cost. And in the third column, you see the average episode cost adjusted for inflation. This chart shows the annual cost for each type of rehabilitation, also from the 2016 study. So in the first column, you see the treatment type. In the second column, you see the cost per person. And in the third column, you see the cost per person adjusted for inflation. Conclusion: it would be more beneficial and cost-effective to keep incarcerated individuals guilty of nonviolent drug crimes out of jail and in drug treatment programs. In drug treatment programs, we often see better recovery and less relapses than we do if they were incarcerated. This is our reference page, part 2. This is our team. John Nguyen created the slides and did the research for the Portugal study and women's study. I organized the information and slides, and I presented. Andrea Garcia added information to slides for public safety, mental health, cost savings, and long-term change. Thank you.